Picture this. Disease X, a mysterious new pandemic, is projected to have a mortality rate 20 times higher than that of COVID-19. This is not some dystopian fiction, but a potential reality that global health authorities are preparing for. The term Disease X is a placeholder, used to denote an unknown pathogen that could cause a future epidemic. It's like the X in a mathematical equation, standing for a variable yet to be determined. When outbreaks of this disease start being seriously recorded, it will be given a more specific name. The information we have on Disease X comes from influential figures like Klaus Schwab and Bill Geist, as well as owners of prominent pharmaceutical companies. These individuals have painted a grim picture of what this potential pandemic could entail. The method of transmission for Disease X is presumed to be airborne, the fastest and most efficient way for a disease to spread. Both humans and animals could be susceptible, which could lead to mass destruction of livestock, reminiscent of the swine and bird flu outbreaks. Multiple body systems could be affected by Disease X, including the respiratory, immune, nervous, digestive, and circulatory systems, as well as skin and mucous membranes. The causative agent could be either a virus or a highly antibiotic-resistant bacterium. Quarantine restrictions and vaccination efforts will likely be on an unprecedented scale, far exceeding those of the COVID-19 pandemic, warns Dr. Jane Goodall, a renowned primatologist and anthropologist. Parents may be required to have their children vaccinated from as young as 3 years old. Medical practices will evolve in response to Disease X. The traditional method of administering antiviruses via injection could be replaced with a painless alternative, a small piece of plaster applied to the skin for a few minutes. However, the impact of Disease X extends beyond health. It could serve as a black swan event for the global economy, potentially weakening or even destroying entire industries. Humanity alone may not be equipped to handle the rapid detection, symptomatic statistics, and vaccination measures required to combat Disease X, says Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases. We must consider utilizing artificial intelligence to aid in these efforts. All biometric and medical data could be consolidated into a single database to streamline disease management. Interestingly, both COVID-19 and Disease X were discussed 2 years prior to their large-scale onset, suggesting a pattern that may help in future disease prediction and prevention. In conclusion, Disease X is not merely a hypothetical scenario, but a potential global health crisis. The key to navigating this storm lies in staying informed and prepared. Arm yourself with knowledge, follow credible health advisories, and participate in preventive measures. After all, in the face of a pandemic, our greatest weapon is awareness and preparedness.